is Dr. Zhang, from an interventional cardiologist in the cardiovascular department of Nanjing, China. And he's going to present on extraordinarily interesting data on a technique that we use each day and we could potentially use tomorrow. And so he is going to give us the lessons that he learned on the issue of how do we treat distal left main disease. It's a really big and important issue.
Thank you, David. It's my pleasure to be here to report the result of DKCRUSH-III trial. This is a multi-center randomized prospective studies compare the DKCRUSH technique versus culotte stenting for the treatment of distal left main bifurcation lesions. As we all know, previous studies show that DKCRUSH and culotte stenting were all effective for non-left main bifurcation lesions. However, their durability and safety has never been randomized compared in distal left main bifurcation lesions. So we designed the DKCRUSH-II trial. Totally, this trial we enrolled 419 patients randomized to DKCRUSH group and culotte group. The primary endpoint is 1 year MACE, and the secondary endpoint is 8 months in-stent restenosis rate. Stent thrombosis served as safety endpoint. The major finding of this trial is for the treatment of distal left main bifurcation lesions, patient in culotte group was associated with significantly high 1 year MACE rate, 16%, mainly driven by the increased TVR 10% compared to DKCRUSH group for 6% and 4% respectively. And the in-stent restenosis rate of side branch in culotte group was 30% compared to 6% in the DKCRUSH group, p-value less than 0.05. And also for the safe branch, stent thrombosis rate in DK group only 0 and 1% in culotte group. Among high-risk patients with the distal left main bifurcation angle more than 70, NERS score more than 20 points, and the syntax score more than 23 points, patient treated with DKCRUSH was associated with lower 1 year MACE rate compared to culotte group. So in conclusion, for the treatment of left main bifurcation lesions, culotte stenting is associated with increased 1 year MACE rates, mainly driven by the increment of TVR. Thanks for your attention.
That was great. Back to you, Gary.
DKCRUSH is a technique that was pioneered by Professor Zhang's boss, Professor Chen Xiaoyongling from Nanjing. It is a technique that was first used in non-left main bifurcations, as Professor Zhang mentioned, to good advantage. There is growing interest in doing stent implantation for left main lesions. We know that ostial and midshaft lesions respond very well to PCI, but that distal left main lesions, which represent the majority of left main lesions, have a higher 1 year event rate. And most of it related to what happens at the ostium and the circumflex long term. So by extending the DKCRUSH technique, which is a specific type of technique to implant 2 stents compared to another 2-stent technique, the investigator showed that the distal left main bifurcation lesions can be treated very successfully with very good 1 year events. It's a little bit of a technical study, but left main lesions are really important. There's a huge randomized trial called Excel comparing left main lesions treated with stenting versus surgery. So there's growing interest in doing this in the United States. It's the routine way to treat left main disease in Asia. And this is this study indicates that maybe the best way to treat distal left main lesions particularly with disease of the ostium and the circumflex is this particular 2-stent technique called DKCRUSH.
Gary, thank you. Our final speaker this morning is Dr. Deepak Bhatt